Welcome, everyone. It's another wonderful afternoon in the East Coast. Looking forward to this amazing discussion we're going to have with Paul and Marv. What's interesting about the group we have together is a little bit of both. You got operations, you got technology, and you got leaders in AI and how to deploy things and make it all wonderful. First of all, thank you all for your time today, the audience as well as our panelists today. It's an amazing day to have this conversation. With all the rapid changes that are happening in AI, context is always the word right now. What I'd like to do is take a few minutes and introduce my panelists. We'll give you a few minutes to talk about what your role is, what you're thinking about. And as you're doing that, I'd love to hear from you about where do you think healthcare is in the AI maturity curve? Or some people may say Gartner's, curve, or you could use any methodology that you want to use, but would love to have you add that to the conversation. So we'll kick it off. Marv, please, background and that question.
Yeah. Hey, I'm Marv Richardson. It's also my background is in the kind of a strange mix, I would say, of entrepreneurial endeavors. I've co-founded or founded 2 companies and had successful exits from those, also a nonprofit. I'm currently on the board or advisory board of 5 different health tech firms. And I have built my kind of deep healthcare expertise, the honest way, the hard way, coming up in the payer world. So I managed all the applications for HCSC, which is a very largest non-public payer in the country with 20 million members, and also EIO managing 4,000 people and an annual investment of $1 billion in technology of digital health and AI and all that good stuff. So I definitely love getting into the guts of how things work, and I've seen them work and not work.
Where do you think we are in the hype cycle?
Oh, good. I think we could get higher, but it's a little bit hard to imagine the AI hype cycles in full bore. The stock market's reflecting that. One of the startups I had was in the .com days, so I have firsthand experience with the hype cycle and its potential benefits and impact. I would say healthcare, though, is a bit unique. We're very excited about what I see. We're very excited about AI in some specific areas, in particular, some of the clinical areas, ambient listening, coding, some of those kind of areas are having massive adoption. In the payer world, it's been a little bit more cautious for the most part, but there are really strong stories to tell in the prior authorization space, in the call center space, and in some other areas where it's already having a big impact, despite the kind of usual tentativeness in a regulated industry of adopting new technology.
Thank you for that. And Paul, please tell us about yourself and the question also.
Hi, everybody. I'm Paul Juan. I'm the Chief Operating Officer for Personify Health, which is one of the largest independent TPAs in the U.S. I've been in this crazy industry for 36 plus years. Actually, could say 40, but it makes me feel even older. It's always been in the operations side from claims, technology, customer service. So really, truly from the TPA operations side. I think from the TPA side, we're in this lovely spectrum of moving AI from just being a personal assistant, because everybody has Claude. Claude helps you do everything from looking at your calendar to, hey, what did I miss yesterday, to making really cool presentations, right? So moving from a personal assistant, I think our transformation is kind of like, as Marv said, is how do we start moving this to an operational? So how do we take the manual and mundane? How do we start involving more technology and taking some of this off of our plate?
Uh-oh. I think, Marv, we lost Paul for a few minutes. It happened. We'll give him a moment.
If we imitation Paul, artificial intelligence Paul would show up right now and start telling his story, so we're not quite there yet.
No, we're not quite there yet. While we wait for Paul to come back, Marv, I know, scaling AI just remains very difficult. There he is. Paul, are we back? I think we need Starlink. What do you think? From a connectivity point of view, I think we need Starlink. Well, while we have Paul come back into our session, coming back to the question I was talking about, why AI scaling is difficult. There's a lot of pilots, there's a lot of wonderful things, there's a lot of adoption, but obviously in a regulated industry, it's different. So tell me your thoughts on why you think scaling AI is not that easy in your industry,
Yeah, absolutely. So I think scaling is always a challenge, especially let's get right to it. Why makes stop scaling from happening in healthcare? I think one of the biggest mistakes that a lot of payers are making is that they assume that once they have the model working, that they're there. They've got the pilot going, the model is set up, it's interpreting the right terms correctly, it's giving you the kind of answers and the guardrails that the answers you want within the guardrails you've set, but it's just the model. So it proves the technology works, but that doesn't. Any of us who've been around healthcare for a long time know that having a new technology work doesn't really change anything by itself. It's got to live inside of the health plan, which has real operating machinery. It's got legacy platforms, you have claim systems, workflow, care management, blah, 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 and then can't forget security, can't forget compliance. And then after all that, someone's got to be accountable for everything that AI is doing. And that accountability model is not solved well at this time. So scaling is difficult for those reasons, but there are some real places where scaling can be effective. And the place I'm seeing the most early success is in the call center space. So for companies that are ready to have voice agents, well, chat agents for sure, AI agents who are conversing with members or providers via chat, that's scaled quite well in a number of different blues that I've been connected with. And then actual voice AI agents who are taking voice calls from members is working. I helped a couple of other blues get that into production last year, and it's seeing tremendous results from that. And the beauty of those particular things is that they can scale very readily. They scale horizontally. They don't require a huge amount of process change because you're really directly working similarly to a human agent. And then the last thing I'll say before I turn it back to you is that I love automation in the call center space because for those of you who know, call center turnover is huge. It's probably somewhere 40%. So just by stopping your recruiting in the call center space, you naturally shrink the workforce and you can replace it with automation without having any kind of impact on job reductions. So it's a good spot to target scaling in the first place.
Yeah, I think, Marv, too, in what we're seeing in the member service call center space is, quite honestly, there's still a lot of people that don't want to talk to a human. So you need the technology for them to be able to communicate. And I think one of the things, most exciting part about the AI is being able to listen to the call, prompt the agent as to what the member's asking, retrieve the information, provide it to them so quickly. And so when you think about that, not only is it speed, but it's quality. It gives the agent the answer, again, as long as you train your AI well, but it gives them that advantage of being able for all of us to be very consistent in what we're telling our members from instructions and things of that nature. So I think it's some great points you made about really from the member services, how AI is coming in there, not just giving us answers or documenting things, but also listening to the call and being able to translate quickly and provide either a voice back or help to the agent.
Yeah, can I, before Niraj, Paul said, and turn it maybe to a lesson for everybody listening. The one thing that Paul said was a lot of people actually don't want to talk to another person. So a member calls in, they'd kind of rather have it be an information source than a person. It's a healthcare thing, a personal thing. And I remember so many conversations last year where people were saying, "Oh, we can't have a voice AI agent talk to a member. They want to talk to a human. They don't want to talk to a machine." I think the lesson here is to challenge assumptions, because I think Paul's right. A lot of people don't, and challenge the assumptions and just make sure you're getting some real data to back up whatever hypothesis you have.
Paul and Marv, challenge the assumption is the statement, right? So I think all of us come in with a little bit of preconceived notion, what the tech will do, how the tech should be utilized, and what adoption will look like over time. And your example, I remember when I was with IBM Watson Health, that was one of the biggest findings that we saw was humans actually gave more information to Watson. So they were able to get a complete picture for a better diagnosis or lack of being judged, all those wonderful things all of us humans worry about. And with that additional information, they were able to do a better diagnosis or help the doctor do a better diagnosis that way, which is amazing, right? How do we make that human factor with this technology and work together is what Paul, you and Marv are talking about. Is like, wait, there's things that the AI should do. There's things that the human should do. How do we make sure that marriage works the best for our consumers, and specifically in such a area like healthcare, not only from the regulation side, but also from the emotional, the connection, and the value side.
I don't think AI will ever replace nurses doing case management. And in many cases, that is the human to human touch. I don't see it replacing that. But if I am in case management, I can certainly use AI to understand things better, to have that human contact. So I don't think those things will go away. But kind of back to an earlier point, does a provider really need to or want to talk to a person? They would rather come in, get the eligibility, get the claim status quickly and move out. And quite honestly, this will sound kind of mean, I don't want to talk to providers. I would rather talk to a member when they want to be talked to, but let the providers use the technology that frees up the human time. Let humans do the human work where it's right, and let technology take the rest.
Reminds me of I'm a car guy, so I don't know if Marv and Paul, you're car guy. So in the old days, if we had an antique vehicle today, you don't know your tire pressure. You go outside with a little a device that tells you the tire pressure, and then we got a little bit of automation in. We got sensors, but the sensor just told you there was a tire problem. It was just the tire symbol. It didn't give you any context. It didn't give you any value, but you still have to get out, look at the tires and say, what's going on? Sensors got better, more information came in. Now with that context, as soon as the light comes on, you don't panic. You look at the thing, you say, hey, tell me what's going on. It shows you all four tires and their pressure. And as you're driving, if it's not dropping, you're like, oh, that's a temperature issue, not a real issue. You keep driving. And as AI is progressing, we think about those things and how that evolution will work with that human interaction. And when do we have to step in and when do we have to make a decision? Do you envision those types of things happening in the prior authorization world? Maybe that's something that, hey, how much context do I need? How much should it be automated? What should I be able to tell? Love to get your thoughts on that, Paul and Marv.
Yeah, go ahead, Paul.
Yeah, sure. And I think there's a healthy balance here. I'm going to say AI is good for a yes. It's not good for a no. If it's a no from an AI, it needs human, because there could be other things that we need to talk about. So I'm a strong proponent of, if it's a no, it goes to a human. We need to look, we need to talk. But even the yeses, you have to do quality review on your AI. And I think that's where people think, oh, well, once I have it, I plug it in, I play, and it's just gonna do everything just fine. And it shouldn't be. You should be thinking AI is no different than a staff member. And do you pull cases? Are you making sure that those answers are correct? And so what we're seeing is, if you just think about what's coming down from the regulation, is quit making free certification so complex and hard. They need to be fast and quick. And so I think from an AI standpoint, that it works great. The technology is awesome. It can take the information, bump it up against your Milliman and Robinson, Roberts information, and give feedback, pre-approved, what have you, or hold on, need more information. And that's where I think it will allow providers, if you think about this, providers from an administrative cost goes down. Whether we'll ever see the price go down, different, but it gives the opportunity. So we can be better stewards of time and money and effort in the healthcare continuum.
Yeah, that sounds great. I would totally. And I'll add maybe a specific area on the prior auth side, or 2 points. One is a lot of states are making laws that you can't say no with prior auth without having a human. And so, just if you're doing business across 50 states, you probably have 30 of them that are going to have a law that drives you a certain way. But when you have to say yes, as Paul mentions, it's great for the agent to serving up the possibility of a no, I should say. If you're serving up that possibility, then you're putting it to a clinician. Well, what is a clinician going to do? There's a lot of things you can do before the clinician has to look at it. So the AI agent should be making sure that it's getting the extra clinical information that is needed to support a yes diagnosis. It should gather that during its own yes/no process. And if it can't decide yes, it's thinking it's a no, then when it serves that clinical documentation up to the clinician at the payer side, then it should look at the 117 page report, all the charts, et cetera, and say it's page 4, it's page 27, and it's page 52 that have a section you need to look at. And that's what you need to do to see if this is a yes or a no. So all of a sudden your clinician time is focused on the places that matter, and a clinician can get a lot more done. And those systems, by the way, that takes only a moderate amount of AI. We had systems like that in 5 years ago, so without using LLMs. So.
Makes sense. And we all are in the same age bracket, so we've seen the internet explosion up and down. We know we're going through the cycle here. One of the questions for both of you is, when this is happening, which vendors do you go with? There's a lot of vendors that pop up. Are they going to be here for the long run? Are they going to change? And this technology keeps evolving right now. And those are big decisions, because how much are you going to bet on a smaller vendor? How much are you going to bet on a bigger vendor? How much sprawl do you have? How much control do you want to keep internally? Love to have the group hear about your thought processes on those.
Yeah, maybe
Paul,
Marv?
Yeah, Marv, go ahead, Marv. Mm-hmm.
Sounds good. On this one, it's easy to get jaded with the number of different technologies that are coming out there. Again, Niraj, you mentioned we're all of a certain age, so we've all of us have seen a few generations of this tech go by. But the reality is, this tech is moving faster than any other tech explosions we've seen. And all of us probably remember that every time we say, "Oh, this is faster than it's ever been before," but this is by far faster. It's just dramatically fast. I think it's important to keep your mind open to adding new technologies along the way. If you're an IT leader or a business leader who's looking at a solution, then absolutely keep your eyes open. But recognize that choosing the best technology is the kind of thing that is hard to do, and in this kind of change, not likely to be correct for more than a few months. So I wouldn't overemphasize a long selection process like we might have done in the past. Spend 6 months choosing the best thing. Do not spend 6 months choosing the best thing. Spend a month choosing the 2 or 3 what seem to be best, and then pilot 2 of them, and then make a choice from. And one more important thing: there's an area to do that. So when you're looking at a solution that fits into one spot of your ecosystem, that's a great place to do that kind of. Myself, maybe a name, but if you were putting a system in place that has to span a large horizontal chunk of your enterprise, and so it's hitting maybe your sales side, it's hitting your customer service side, it's hitting your plan design, it's hitting a bunch of different areas. In that one, I do think it's important to be a little more careful, because the success or failure of that implementation won't be the technology, it'll be the way you redesign the workflows, and that is and so those kind of the broad plans.
Makes sense. Great comments, Marv. Paul, anything to add? Or
I agree with Marv. I think, the old crawl, walk, run, which I'm a big fan of, it all depends on the scope.
Yes.
To Marv's point, if it is enterprise level across multiple things, you do need to crawl. You need to do the walk. But when you can isolate it or narrow it down, you can move much faster. And quite honestly, if you take 6 months for some of those designs, it's already old. There's already somebody doing it twice as fast, twice as better, and twice as maybe even the cost. So I think this forces us to really have an open mind, not to don't take offense to this, but not where the IBM days. I need the big blue, to be able to do this. We have to be nimble, and where we are in this, the whole technology is, if you're not nimble, you're going to get left behind. So make the decisions, do your homework, but you'll find that if you can narrow down that product, that offering, number one, it's safer. It's not going to go across your whole organization, but it also gives you a chance that, guess what, they may be able to expand in other areas. If it's across enterprise, you do need to take your time, because it's your reputation, it's your company on the line, and if it affects all the way across, it's going to be tough to recover from that.
No, makes sense. And you both are touching on an interesting point. Do we use AI technology only as a productivity tool, or a transformation platform, as you're both describing? Some of it's, you may crawl on a little bit of a productivity, but you have your eyes towards the future. Is that how both of you are thinking about it? Are you thinking about it from, I take pockets of productivity and then eventually sequence it into a transformation?
I kind of look at it in my mind, everybody has a different definition of transformation. I think from a productivity, it's pretty clean, cut, dry. It's the manual, mundane. How do you automate? How do you deal with mass amounts of processor? But the transformation, when I think of transformation, it's how are you going to do it better? What's the next product or offering that you're going to be able to bring through, because you have more computing power to think through, by gathering up all the data that it can come through and glean and say, you know what, this is an area that you need to go out on. So that's what I think that's what I think of the transformation side of it, is it can dig with just the vast amounts of data and help you get to things faster from a product standpoint, offering services and things of that nature. So that's how I think of transformation. Again, very positive on what it does for automation and production. Yeah, manual, mundane, easy things, tsunami alerts, things of that nature. But the transformation, I think the tool will help us advance ourselves in much more offerings that make sense in our world.
That makes sense.
Is a question that relates or has different answers for different sizes of organizations. And so when you're a large scale, like Paul runs, or HCSC, those kind of big scales, you have to be very thoughtful on the transformation side, and the organization will give you organ rejection if you're not doing it in the right way. So there's a human aspect. The technology is not the biggest issue; it's the human aspect that's the big change. I would say for small organizations, especially newer organizations, you can go all in. So one of the companies that I'm on the board of, they have gone 100% in on AI foundation. They've created an AI bot for each of the core functions, including the general counsel. So there's like the CEO happens to be a lawyer, and the general counsel is an AI agent that he has trained. And I'll tell you, the speed with which this small company can operate is absolutely mind blowing. So what I would say for larger firms, like I think back to when I was at HCSC, for example, you would want to try specific areas. You take a division, a department, maybe a small area, and say, hey, why don't you guys go and really do a transformation, but do it in this compartmentalized area and see what lessons you learn about the organ rejection and about the human dynamics of the change that you're making, and then try to apply that in a larger org. I think transformation writ large for a multi-thousand person company is something you should approach a little more thoughtfully.
Great comments, great comments. And as you think about not just the transformation but productivity, there's a lot of noise in the market right now about ROI on AI. You hear all the horror stories with token cost. Oh my God, all these dollars that are flowing out the door. What's going on? How are both of you approaching ROI, and how do you measure? Are you measuring these with different thought processes, or the old thought processes on time saved and speed? Would love to get your insights on that, Paul or Marv.
And Paul and I are first, so that's kind of fun. On this one, a couple of things. One, it's important to find the ROI based on not just a cost or a cost plus kind of scenario, but based on real cost you're taking out of the ecosystem. Mm-hmm. So answering a member call for a payer, depending on the payer, takes cost to $15. And so if you put the right solution in place and you're working with a voice AI vendor, then put in a contract where you pay them per call that they 100% satisfy. So there's no callback, and the member gives you a satisfactory rating, and then pay them $5 a call. And you've saved $5 or $10 on that call. ROI super clear in those kind of areas when you can do it. I do think the tougher one is all the scare headlines that we've seen about these token costs going through the roof at some places. And what naturally happens is large organizations then start to give people a token budget, and it becomes a very small token budget. So it's like almost like, wow, my developers can't even go to work now because they've exhausted their token budget by 10 a.m. I think that's an area that no one has a good answer for yet, but that you've got to kind of create the token budget for the person in a role and monitor it and change it, every month at minimum, maybe even more often than that as we're learning where it's effective.
Yeah, I agree with that. I mean, if I look across our organization, and I want to pick on Claude, it's my friend, we definitely have different budgets for tokens. It's from a developer standpoint, from somebody working in marketing and things of that nature. And if you kind of extrapolate that out and you think about the AI being used for customer service, just look at all these data farms going up. They're huge. That's what AI is running on. It's GPUs. Just think of that. It's huge, costly. So there is a cost to AI, and it's heavy. And so as you think through the ROI, and I'm going to pick on customer service, I call it call avoidance. If a person doesn't have to pick up the phone because it's answered the question, then I can do a couple things. I now need X number of staff members to be able to handle inbound calls. And rather than immediately thinking of, well, I get to cut, I get to cut heads. No, I get to scale up. I can grow without hiring. And, that's a delicate balance. But I think as you look at the ROI, you have to be really careful with that. You just can't add dollars to your budget of expense without taking something back out. So whether, it needs to be more than $1 for $1, but I think as you go through that, you think about it. I know I talk to my employees and fellow workers that they're like, oh yeah, but it can do this for me. I'm like, well, I need you to show me that it really does that for you. Because it's not a toy. I use this phrase all the time. Is it a toy or is it a tool? Toys I'm not going to pay for. I'll pay for a tool. And that puts a little bit different ROI thinking in their mind of like, I'm spending money, I should be getting something out of this. And so as you think, whether it's member services or just more productivity from your staff and better quality of information coming from your staff, that's, I think, is how you look at the ROI.
No, makes
Niraj,
sense.
You gotcha.
I'm back.
You lost your.
Yeah, I don't know what happened. I lost my background too. Mine is not as nice as yours, Marv, but it happens. Technology, as it always happens, there's always something interesting, which is the best part. Marv, you brought up an interesting thing as you were talking. I was thinking about this. Will AI give me the toy will always give you adoption, right? Any toy is fun. They'll play with it. You kind of get adoption. It reminds me of one of the conversations I was having with an insurance player's CIO who was monitoring all the token costs. And the number one user was the CEO, right? So it was a toy, it was having fun, and it was blowing through the tokens. Now making it a tool made a really big difference in how to make it more valuable. So would you call that's more confidence? And the tool gives you confidence, and as more confidence comes in, adoption comes in, real adoption versus toy adoption. And do you view that?
I think there's
the confidence will extend out to consumers, right? So if I know that I'm interacting with an agent, an AI chat agent that always gives me the right answer, it's going to give me amazing confidence.
Yeah, a great set of questions. AI the most rapidly should be pushing it to every employee, or every employee could use it, should get some level of access right away, just to build the confidence and the trust, as you mentioned. Even if they're using it just to maybe take some meeting notes, or to help them address a query from their manager, or whatever they have going on, just to be able to use that. So if you're a Microsoft organization, get Copilot, give your people access, and start getting that trust built. The real advantages come through other solutions, not just your kind of day-to-day Copilot. You need to embed it completely into your workflow to get things going, and those will rely on that trust to happen. For members, I think trust is going to be tougher. I have been around long enough. I'm by no means a naive believer in technology solving things, but I'm definitely on board with the AI bandwagon because I've been using it for a couple of years and just seeing the dramatic difference. I'll tell you what, my house is a house divided. My wife is not a big fan of AI. She does not think it's good. She reads the same stories I read, and gets a different interpretation from them. So I do think that from a member perspective, we want to give people choices similar to I think we all remember getting a lot of mail from our payers. We'd get, everything would come via paper mail. And eventually you could select whether it was financial services or payers or whatever. You could select to get things electronically. And you kind of allowed people over the course of time to choose their own adventure. I think that would be a good idea for some of where it can fit in a member-centric situation. I know that if I was a member, even if my wife was a member, and you said, you can talk to an AI bot right now, or you can be on hold for 22 minutes for the next human operator, I guarantee you the AI bots will get a lot of more confidence in that scenario. So.
I think all of us have that house divided, Marv. My wife is the same. I'll try everything and she'll say no, even down to the self-driving pieces of the car. I'm like, no, put it on autopilot on the highway at least, and that always happens. So it looks like we're coming. There's a lot of question and answers. So I think Marv and Paul.
It was like, or on a gender. My daughter is all into AI, so this is not a gender-specific thing. Just happens to be two husbands and wives who have the same scenario.
I agree. I totally agree. Same. My daughter is super sophisticated too. So and we learn from them.